And it's growing increasingly, protracted and bitter, some would say, Ellie.
Certainly is, Mark. Good afternoon to you. Yes, we're outside the southeast coast ambulance headquarters here. This is where half of all ambulance calls come in the southeast of the country. And you can see on the picket line here that we have some of the call handlers and the dispatchers here. I'm going to share some of their signs. Understaffed, undervalued, underpaid on this one. Value your NHS. And down on the floor down here, another sign. Patients aren't dying because we're striking. We are striking because they are dying. Just some of the signs on this picket line. It is quite a small picket line right now. That's because they are taking it in turns to come out from the calls that they are taking inside. We're going to expect about 25% of staff here at this headquarters to walk out today. The rest are staying to answer those emergency calls. So at this point, I want to bring in Liv, who joins me now. Liv Whitfield is regional organiser of GMB here in the southeast. Liv, why are we here on the picket line? What are you striking for?
This is the fourth day of strike action by GMB workers in the ambulance service because last year they were awarded a 4% pay rise, supposedly. Inflation is above 10%. It's another pay cut. They've had pay cut after pay cut after pay cut, on average about 20% over the last 12 years. They have had enough, and the reason it's such a massive problem is because they can't get the staff to work in the ambulance service because the pay is so low.
And the biggest criticism of all NHS strikes right now, not just ambulance workers, is that this is selfish, that they are putting people's lives at risk. What do you say to that criticism?
I mean, a lot of that criticism comes from the government deliberately because they want to shame these workers so that they can underpay these workers. And that's what it is. They are actually striking. Yes, it is a selfish issue for pay, technically, but actually they are seeing more and more colleagues leave the ambulance service. They cannot get enough staff to work on ambulances to provide the patient care. We have 130,000 vacancies in the NHS because of the lack of pay. It's not an issue that we should be ashamed of, that our members of staff in this service deserve a decent pay rise.
Do you see a resolution coming down the line anytime soon? The Health Secretary says that now is not the time to ask for pay rises with inflation as high as it is.
The government said in 2010 it wasn't the time to ask for pay rises. They said in 2012, 2013, every single year for the last 12 years, they've said to the NHS, now is not the time for decent pay. When is going to be the time? My members, in half of all the trusts across the country, there are food banks for NHS workers. They have to be paid at a decent rate so we can actually provide staff. And you saw the sign here. Patients aren't dying because they're striking. They are striking because every single day, members of the public are coming to harm in ambulance queues, in ambulance waits, because there are not enough staff.
OK, look, we'll have to leave it there. Thank you so much for your time. Well, just a word from the government there. There's Steve Barclay, the Health Secretary. He has pointed to warnings from the Bank of England about the rate of inflation. He says talks have been constructive so far, but he urges the unions to call off their strike. Well, that is not the case so far. As you can see behind me, the GMB union saying that 11,000 ambulance workers will be out on strike today, and there will also be some from the Unite union as well. But Mark, in the next few weeks, we are going to see an uptake in NHS strikes. We are going to hear from the junior doctors a little bit later on the results of their ballot. They could be out on strike next. That will be confirmed later on this afternoon, but it does look like the next few weeks and months could be a lot of upheaval in the NHS, and it doesn't look like a resolution is coming anytime soon.